Hi, my name is Juliet, and I'm the creator and host of Connecting the Dots podcast. I love ideas and problem solving, and my career in communication has led me down a path of curiosity. Why we do what we do, how we tell better stories, and how African scientists solve everyday problems. Join me on this enlightening and entertaining exploration of African science like you've never experienced before. Get ready to laugh, learn, and be inspired. Health is often framed as an expense, but what if we viewed it as an investment, a foundation for economic stability and growth? Strong health systems not only save lives, but also drive productivity and build resilient economies. Yet many African countries continue to grapple with an underfunded health sector, a challenge made even more urgent with the sudden withdrawal of funding from key partners like the US government through USAID cancellation. Globally, there are lessons to learn. Countries like Japan have achieved universal health coverage, ensuring access to care for all their citizens. While the United States, the world's largest economy, still faces deep inequalities and high costs in its healthcare systems. So, what will it take for African nations to secure sustainable health financing? And how can we shift the narrative from health as a cost to health as a smart, necessary investment? Well, to answer some of these questions, I am joined today by none other than Dr. Mary Moussa, an Egyptian-born pan-Africanist, health specialist, and business development expert. Dr. Moussa has a strong passion for advancing human and minority rights, especially in the areas of mental health, gender equality, and social justice. She has contributed to the development and implementation of innovative and sustainable solutions to improve health outcomes and access for underserved communities on the continent. She leverages her medical background, management skills, and leadership abilities to design, coordinate, and also oversee multifaceted sustainable health projects, engaging partners and stakeholders at all levels of involvement, including the private sector, while leading teams across countries in its implementation. We are very excited to talk to you today. Karibu sana, Dr. Moussa.
Asante.
It's exciting to have you here. And one of the things we want to start discussing is to understand what are the decisions that led you from practicing medicine as a medical doctor to the world of health business.
Oh, okay. So
Explain yourself.
Yeah, it's a tough one. And I was wondering, should I tell you the politically correct answer? I tell you the actual story, which I think many young doctors are going to relate to.
The actual story.
So the actual story for sure. So I graduated medicine from in Egypt. And afterwards, I moved to Uganda because, as you said, I'm a pan-Africanist and I'm like a fish outside of the sea if I travel outside of the continent. And I'm very much against the brain drain that is happening. So I wanted to invest everything that I have, all the skills, all the ideas, within the continent. Doesn't really matter which country, because for me, it's one big nation. So I decided to go to Uganda and pursue my medical career. I started practicing. I joined Makerere University, did some research on nanotechnology, which ended up going nowhere because we didn't have labs to take it to the next level, unfortunately. But that's another story for another maybe podcast. So I was practicing at the same time. I was trying to do my master's of medicine in psychiatry. And to be honest, it's a tough road for most clinicians. The politically correct answer is like, I wanted to have a bigger magnitude of my skill set. Yes, a bigger impact, a huge impact, where you're actually serving a bigger population, which is actually reality. And this is what I'm trying to do right now. But also the other side of the story was the burden that happens on the medical professional when you're trying to get your specialty and at the same time you are trying to work for a living. So you end up working and studying at the same time, which was sustainable for me for a year and a half till I crashed completely, because definitely it's not easy. And I'm one of many. I'm sure that the same was happening in Kenya, the same in Uganda, the same in Egypt. We are paid very little. We are overworked. We're overstressed. We saw colleagues going through very, very rough times. So I came across an opportunity to go into healthcare management. I was offered, instead of practicing, I was offered to manage a diagnostic center that was a collaboration between the Egyptian government and the Ugandan government. And since I was more familiar with the setup and the ecosystem in East Africa, I made sense for them, I believe, at that time. So yeah, I got into management, and for me, it was a shortcut for a better career.
Yeah.
Otherwise, I would have chosen to be an orthopedic surgeon, to be honest.
Oh, wow.
But I found myself into that direction, which I enjoy now very much because, as you said, the projects that I design or implement, I can see they can be scaled up, and I can see the effect. That you can take them to many countries, you can take them to many levels of healthcare provision, and for me it was more satisfactory than seeing one patient at a time. Of course, that is great on its own, but I think the universe maybe has chosen the path for me.
Yeah, I think different people, different paths. What example would you be able to give in terms of the successes you've achieved in the new role that you are playing?
Oh, wow. So the role that I'm playing right now is relatively new. So I'm head of consulting at a pan-Africanist also consulting firm called Africa Health Business. And I think what I'm proud of what we are doing, the team and myself, actually. I have an amazing team that's working behind the scenes and sometimes in front of the scenes, is that we're giving an African perspective to data collection and market access. So we don't assume or we don't make decisions on what we need to know and where we can access that kind of information from an outsider point of view. We are bringing almost localization of data collection and landscape, market landscaping. So I think this is the proud thing that I'm working on right now.
What would you say is the biggest problem that you were addressing by providing that African perspective to data collection as well as just information on market access on the continent?
I would say two items there, or two factors in there. One, the availability of data in the African continent. We have very scanty data. And again, most of data is collected with a foreign eye or a foreign perspective. So it doesn't really sometimes match the reality. So it's hard for a consultant to go dig deep and collect. When we do projects with some global counterparts, it's very easy for them to find data. All the data is there and published and public, and everyone has access to it.
Yeah.
For us, it's one, very limited. Two, not everyone has access to it. So it's either the funders, the ministries. So it's a bit hard to get access to these data. And the second thing is also the client or the partner expectations, because the time and the effort that we exert into having the project to completion or collecting that data does not match what. And I give them excuse because they come, and again, from a setup where everything is there, everything is available. They just need to go and extract the data and analyze it.
Yeah.
For us, it's not like that. Also, the ecosystem is very diverse. So the client expectation sometimes to meet them, to explain to them how things work, how things can take time. To provide quality data, you need to give 10 times more effort than you would have done in maybe Japan or the US or Sweden or whatever other countries that have not better system, but different systems, I would say.
Yeah. I mean, you touch on infrastructure, human capital, even having the skill sets on the continent to be able to collect this data, which is what other countries have the privilege of. And sometimes for us, it's not something that we can take for granted, that we need to put a lot of effort to be able to do the sort of data collection that they've already been doing for lots of years.
Absolutely.
But, you touch on data, and data is such an interesting one because very recently we saw what happened with data, especially when the US pulled out. Yes. And suddenly a lot of the data that had been collected kind of disappeared overnight.
Absolutely.
And I wonder, from your perspective, and in the wake of the dramatic withdrawal of the US government from WHO, and with USAID, how do we go about filling these gaps? I don't even know where we're going to start if you think about the data that has now disappeared overnight.
Yes. So let me, Juliet, first tell you that what's really dramatic for me, it's not even the USAID withdrawal of funds.
Okay.
What's really dramatic for me is our decision-making process, where we have made ourselves vulnerable and dependable on their funds to the extent that it paralyzed us completely.
Right.
That is what, for me, is really, really dramatic. And now we're trying to see what emergency plans, what we can do, risk management, trying to fill the gap.
A little too late, maybe?
Very late.
Yeah.
We should have done that. And I think this is where we are failing, to be honest, as a continent. Our planning, our forecasting of what is going to happen, it was very evident. And we have seen like cuts of funds, gradual cuts of funds. But instead of trying to plan for it, to protect ourselves, protect our data, protect our people, we got so comfortable. And for me, that's extremely dramatic. And I'm really hoping that we'll see a shift in how we think and how we behave, again, collectively as a one African nation, because we all behave the same. We all strategize the same, and there should be changes and shifts. But going back to USAID and the effect on data, but also the commodity availability, test availability, the data that has been collected. I just came back from a hike, the very well-known conference hosted by AMREF.
Yeah.
And we were saying that it's not only that they own the data if they pay for it, but they own the agenda of collecting the data. Which data is important?
Yeah.
Again,
it's a new oil.
Absolutely. And data is money. And unfortunately, we have been seeing data, and I have seen, I'm sorry if I'm being a little bit opinionated about that, but ministries of health are dealing with data as a business. Collect the data so that we can sell the data.
Oh, like continental ministries of health?
Absolutely.
Oh, wow.
Absolutely. So there is collect the data so that we can put proper strategies in place. There is collect the data so that we can sell the data, because data is money. And again, it's not a private farm, which I think many African governments are dealing with their countries as if it is a private business. It's not. There should be a little bit higher level of nationalism.
Yeah.
That we prioritize which kind of data I want to collect to help my nation grow.
Yeah.
For example, Western countries are interested more in infectious diseases data, right? Like hundreds and thousands of dollars and millions of dollars on TB, HIV, which is very important. But now we're seeing a shift in the disease pattern. We're seeing more people passing away with NCDs,
strokes,
hypertension, diabetes, strokes.
Right.
How much money are we investing into collecting data around those diseases?
Yeah,
because because those diseases, they don't cross borders. They stay with us. Yeah. It's our own issue. And I don't blame Western countries, honestly. I'm blaming us. So again, going back to your question, we should fund our own research. We should fund our own data collection, because at the end of the day, we should hold the priorities, or we should advocate for the priorities at a national level and a continental level.
I am looking at an article that you wrote February 5th.
Yes.
Just immediately the US government was beginning to make this missives. Every week you were seeing something that's happening, or a directive from the president. Yeah. And your title for the article was Reshaping Africa's Health, Financing and Targeting Autonomous Government.
Yes.
For governance for sustainable growth. And just to look at some of the points that you were raising, and you should talk about this. I'll let you say, because this is a piece by you.
Yeah.
You looked at the healthcare landscape in Africa beyond aid.
Yes.
I love the use of the phrase, don't put all your eggs in one basket. But in this case, even the basket
is not ours. Yes.
So just a little bit about this article, and what are the ideas that you're proposing, for domestic financing, for example?
Yes. So again, healthcare financing, if we look not only in the African continent, but even globally, it is a huge task. I wouldn't say a burden, but it's a huge task that governments sometimes, they cannot bear it alone. they need all the help that they can get. And that's why we bring private sector into the picture. That's why we bring impact financing into the picture. But we cannot also say like governments, it's okay, we'll help you with innovative financing. You chill and put money elsewhere, unless you're putting money in education, then I will forgive you, honestly.
Yeah.
as a pure Africanist, like I feel for the people, because yeah, for sure, those are our like families back in the village that are not accessing healthcare. So allow me to be a little bit passionate. Yeah, so unless you're putting it in agriculture or education, then I will tell you, yeah, maybe I can understand why, even though in that sense I wouldn't also excuse them very much. The government need to play a huge role. The government need to shift priorities. Maybe budgets for like official personnel, members of parliament, ministers, military spending need to reduce a bit.
Yeah.
Maybe
Absolutely
at least
agree on that one.
thank you.
Yeah.
at least for the short and medium term plan, you have to invest in health, because otherwise you have a very weak nation. The disease burden does not only affect our pockets, it affects our minds as well. Nobody's going to be productive on an intellectual or physical level if they are exhausted, either them going to the hospital all the time or taking a family member to the hospital all the time. So yeah, governments, I'm really sorry, you guys, but you need to put money more into health. We can help with innovative financing. We can help to see who can come in and fill which gap, which I think the private sector is ready to do that. We can also help strategize how we can drive tax straight into the health agenda. So yeah, everyone has a role to play.
I really like your example about, military spending, for example.
Yes.
And I wonder if anyone, maybe it's African Health Business, AHB has done this, where you've assessed how much money is going to the military, for example. How much do governments spend in military? In our earlier podcast, we had Professor Sam Kinyanjui, and it was funny because for him, he called researchers, and we don't think like this. He called researchers creating an army of researchers who can fight diseases that don't know borders.
Yes.
And recently we saw, even with the UK, for example, UK said, we're going to start looking within as well. And UK decided they will increase their spending on military as well. And I understand, the situation around the world. There's some wars happening in Europe and the need to protect their very own citizens. But one of the things, I really want to highlight for you in your article, the takeaway points, and there were three, whether it was around governance, whether it was around private sector, and also the role of Pan-African organizations like the Africa Centers for Disease Control, Africa CDC. You said the role of Africa CDC in strengthening health systems as a Pan-African autonomous agency, and you called for the participation of regional economic blocs. They must take a strong lead in setting the agenda for sustainable health financing and implementation. On the part of private sector, you said private sector as a strategic partner to address the aid freeze. You've just talked about them, that private sector must enter fiercely. We're not saying that government should do this alone, but the private sector must enter fiercely, show goodwill and the trust of governments as a trustworthy ally. The private sector, when guided by national priorities, represents a committed and reliable partner targeting long-term sustainable solutions. So on private sector, how can we foster public-private partnerships in healthcare that prioritize accessibility and public good without allowing profit-driven motives to overshadow the goal of equitable health provisions? So I think there's two questions really. Can we encourage private sector to come in? And can we also stop them thinking in a capitalistic, more, you've talked about nationalism.
Yes.
Yes,
Absolutely.
If you're based in a country, you want to see that country excel. You want to see its citizenry work well. We've been talking about a young continent, so you want to make sure that everyone is healthy to be able to become productive.
Absolutely. And to be able to also purchase your products. So even from a capitalistic point of view, you need to invest into a population that is going to become your consumer.
Right.
And I think, you remember we were saying that maybe the countries are not focusing on term policies, but
Yeah.
private sector actually focus on
It has to.
long-term policy. Absolutely, absolutely. And all of that like strategization comes from the hunger, I would say, for profit, which is, if we see it as not a very bad thing, but if we also control it, like there is a limit, there is a cost limit, there is regulations, there is also giving back to the country. I think we can use the private sector very well. But right now, what I'm seeing, to be honest, is that the private sector is very willing to help governments,
Oh, wow.
is very willing to step in.
Yeah.
And we have been seeing over the years all of those access programs, how to reduce the prices, how to give equitable healthcare. But again, even though the private sector is very much willing to come in heavily and invest in countries and African countries, we need to know that filling that gap is not going to be their mandate for a very long time. Again, I don't want us to do the same mistake replacing, maybe I will use an interesting concept,
Yeah.
replacing one toxic boyfriend with another.
Okay, yeah. That's a good one.
So,
Yeah.
like replacing the funders who had their own agendas driving us for years and years, and suddenly say like, oh, I'm sorry, it's not my problem, you have to deal with it, with another, boyfriend who's
Has
like,
their own agenda
oh,
as well.
of course, absolutely. Because at the end of the day, we need to understand, as you said, private sector main like driving force is profit.
Yeah.
And that's the reality of it. But how can I give them an enabling environment to get that profit so that I can also force them to invest into my health agendas and health priorities? It's a give and take with the private sector, to be honest. And governments need to be very aware of that. To also maintain a very transparent and very trustworthy relationship long term with the private sector. Don't over push the private sector. Also be smart about your ask and understand that they will eventually come and say, what's in it for me? Do they have goodwill? Absolutely. Would they actually contribute? I think private sector would play a better role in the economic development in Africa better than the funders, because they don't disrupt.
Yeah.
They come, they are here
They
to
augment.
stay. Absolutely. They want to invest. If they start manufacturing in your country, they're even like trying to build a skill set. They're giving back to the community. So analyze them, use them well.
Yeah.
But from our assessment and also from all the clients of Africa Health Business and our partners and all of those, they're very ready to fill the gap. But let's fill it in a smart way this time.
I'm very surprised that they are willing. Are there examples of good private sector partnerships that you've been able to study, and good case studies that you can maybe share as an example or examples?
Oh, absolutely. Plenty of them. Like I mentioned, the access programs that either makes diagnostics available or subsidized, that makes some medication or treatment lines very affordable, very subsidized. They send it also to the last mile. I'm not going to name partners, but some of them are investing even in the last mile.
You were going to give us some concrete one, like Coca-Cola Company, the airlines industry.
We sell those information. So unfortunately,
okay. Fair enough.
You'll have to. Some clients are actually going to the last mile, supporting vaccination programs with the Ministry of Health. Some of them are trying to do heavy health system strengthening, whether in collecting the data, directing the community health workers. Some of them are starting CMEs, which is the Continuous Medical Education Series, to make sure that the skill set of the physicians is up to standard. Some of them are doing placement models of their devices for diagnosis and treatment at government hospitals, at university hospitals. So I have been seeing plenty of examples, and long before the USAID has cut the funds. So they have been there.
Yeah.
But right now they are a bit on stage because we are expecting them to fill that gap. But they have been there. They have been there for years.
You're making me, I came in initially on this recording a bit vexed and upset about this current situation, but now I'm realizing actually it's not a lost cause, that there have been ongoing activities, that maybe this is a time for them to come out strongly and be able to, plug into the gaps we were just talking about that needed to be filled. I want to move you slightly, and sorry, before I do, the categories you've provided are health on the healthcare private sector side of things.
Yeah.
Have you seen any contribution by private sector away from health?
Definitely. I mean,
and in which industries? Pockets, you don't have to mention the partners, but you could say, is it tourism industry or?
Tourism is there and very strong, and African-based, African-owned. Also globally, they are trying to localize, having offices around the continent. The biogas industry, for example, have been trying to invest largely.
Oh.
And yes, and trying to showcase global ones and ones that also that have implemented projects in South Asia that has gained traction and profit. They are trying to replicate the models and invest into the continents. And again, most of those cases, especially if we're talking about agriculture, biogas, and all of that, which is, I think, is related to health, related to climate, which should be all one big topic that is not segmented.
Yeah,
they are investing heavily in the continent. And they are not, most of them, they are not yet profitable, but still supported by impact investors, which I think they play a huge role into this because they support private sector ideas that might not show immediate ROI, that is not transactional now, but on the long run, it will be. So they also have been investing in the continent in multiple sectors, not only the health sector. So
wow, the gaps in information that we lack. Moving you from private sector into our Kenyan, our very own Kenyan healthcare landscape. We are currently experiencing, well, I don't even think we have been for the last couple of months experiencing very contentious changes in our health financing in Kenya.
Yeah.
I don't know if you're currently covered by the
one and only.
I don't even know if we should mention names, but SHA, SHIF, the whole conversation. What's your professional assessment of how to improve public health financing? And, is there any good that can be found from this current model that the Kenyan government has decided to take? And I'm not advocating everyone should pay taxes, but I think sometimes we're seeing situations where, people who have to go for kidney dialysis, for example, they're not accessing the healthcare they did in the previous regime.
The emergency patients, and we heard horror stories, unfortunately, about all of the patients that fall into that gap in the transition between NHIF and SHA. In theory and now in practice, because it started the rollout, it's already there, the packages, and all of that. In theory, it was a great change.
Okay.
I do think they are really trying to expand into covering more disease areas.
Okay.
Covering more diagnosis and screening, covering more treatment. They are trying to shift in between the investments in different packages to cover more, basically. So again, in theory, it's great. It was great. It's still great. I believe from our discussions, they still have I think every year or 2 years that they review the packages and they review the estimates of expenditure in each package. I think where we have failed, and allow me to say we, again, I believe that Egyptian, Kenyan, South African, Botswanian, Senegalese, we're all one people.
All the same.
Yeah. Absolutely. And we have the rights to support each other, but also criticize each other. So where we have failed is the implementation part. And this is something that I have been seeing in lots of policies in Kenya. Kenya is leading into writing policies and guidelines.
Yeah, I'm not surprised.
Yeah, we're very good at that.
Yeah.
We produce them pretty early.
Bright minds putting together some amazing guidelines adapted by different countries, including Southeastern, the Asian tigers, as I said, way back.
Absolutely.
1970s, 60s.
Even in the region, whenever we want to benchmark on a topic, on a module, on a guideline, on a policy draft, we say look at the Kenyan one.
Wow.
So absolutely. So yeah, we draft amazing documents, but I think in the process of implementing, we thought it could be easier. We thought it could be smoother. And maybe this is something that we have, again, collectively as one big African nation, that we need to do a little bit deeper risk assessment before we jump into projects.
Okay. Say more about that.
So if risks are anticipated, there is a mitigation plan around it, and it reduces the magnitude of the risk.
Okay.
Meaning, if we have anticipated this gap coming, that no, it's not going to be a smooth. What if it was not a smooth transition? What if the IT system has failed? What if the system crashes? So anticipate for the worst and prepare yourself as a nation. What is your backup plan? It's easy to say. I know we're not trying to lecture anybody.
Yeah. What do we know about managing 40 million Kenyans?
Exactly. It's also a huge burden. This is something that we don't talk about quite often. Running a hospital is quite hectic. Running the healthcare for a country, it's not easy. So it's easy also to stay here, and in theory, we speak about like we should have strategized better for a smoother transition.
Yeah.
But it's not easy. It's not easy, and it has many parties involved. So maybe our call would be like reduce the bureaucracy so that your processes are seamless with less departments involved.
Yes.
That will make the whole process much easier, and it would reduce the distractions. Absolutely. And it will give you a better idea. How can you implement? Like with reduced resources, almost risk-free. I think it's about the processes. Again, it's not about the mind, as you have said. We have plenty of experts.
Yeah.
It's reducing the bureaucracy. I think it would have made a difference into that transition.
It's interesting to hear about the positive take that I mean, you're busting all my myths today. I don't know what's happening, Mary. It's interesting to see the way you're positive about SHA, and I hear you. Perhaps it was in the implementation, in the staggered approach of the insurance itself. So I guess we'll wait to see what's next on that front. But I think the inclusion and the utilization of the brilliant minds when it comes to policy making and decision making, and then the rollout, because even with USAID, the minute the president pulled out USAID and we saw mothers and children who had or were receiving HIV treatment, for example, they had to come back and say, oh no, for mothers and children, let them continue to receive the care. Because again, we were at a risk of losing on a lot of young children and mothers as well. Moving on to, you just got back from AHIC, as you've said, which is Africa Health Agenda International Conference by AMREF in Rwanda. What have been some of your major takeaways for you? I know you mentioned a few, but maybe the top 3 from that meeting?
Top 3, I would say, first of all, being there, it fed my Pan-African soul.
Yeah.
That
Why?
It's in our own hands, our decision-making process, it's in our own hands. The research, it's in our own hands, how we design even the health systems so that they're localized. It's not an industrial copy-paste kind of model that doesn't fit our need, that doesn't fit our social norms, and it's not culturally sensitive.
Yeah.
So for me, it fed my soul being in that atmosphere, to be honest. So one thing again that has been repeated in there, and I think I mentioned it just now, is the localization of the healthcare delivery systems. How can we deliver healthcare based on our need? And again, this is the dark side of fund, where the healthcare service delivery systems might not be even designed by us as African experts, might be designed abroad, brought to us. And this is how you are going to tackle the HIV issue. And this is how you are going to deliver primary health care. And when you mention something different as traditional healers, you get all the
opposition,
what, and
traditional
the faces.
Knowledge.
Absolutely, and it gets rejected. So it is something that I also got quite often from experts at the conference, that we should just be localizing our solutions. And we have been seeing examples like acupuncture and Ayurvedic medicine and all of that. So I really want to understand what's the difference between that and when we say traditional healers. Of course, not everything is acceptable, like academically or scientifically acceptable, but it doesn't mean that we throw it all in the bin.
No.
Some of it's actually passed through generations. It's wisdom. Let's, us as African experts and academics and scientists, go back, analyze what's useful and what's scientifically proven and adapt it
Yeah.
to reach that primary healthcare, equitable service care delivery to the last mile. So there was a lot of talk at a hike about the localization, which I really support and stand for.
Mm-hmm.
There was also a talk about, again, the African nations and the Africa CDC role. I'm so proud that we finally have our own CDC that is focused on disease surveillance from an African point of view,
Perspective, yeah.
based on our, again, unique, I wouldn't say unique outbreaks, but our unique disease burden, our unique, the country is set up as well. So
Our genetics.
Absolutely,
Yeah.
absolutely. So I'm really hoping that we go more into that, like clinical research that is based on our genome, not other genomes.
Right.
Because we have been saying, I'm sure you have heard all the gender speech on research, how all research was made on a white male, and that's it.
Experimenting
Exactly.
on yes.
So if females of white descent, they differed so much from like the research results or the clinical trial results from a same race male. Now imagine a whole different race, and very complex races, by the way.
Yeah.
So we have a very complex genome that we need to really study and understand the effect of medication on our bodies, how our body react to it. So that's something that was also discussed in there, that I'm very like, yes, let's do our own research, our own agenda, also on us, for us.
Yeah.
Yeah.
So more African-led, driven, funded.
Yes.
Funded.
African-funded, African-led, African-oriented, everything African-owned,
Yeah.
so that the information is ours. The information is not collected for some external lab somewhere, just using it
Yeah.
for data analysis. We want to use it to serve the patient. We want to use it to serve our populations. And again, not to sell data.
And we hope that Africa CDC is contributing to this majorly. And we're always grateful to John Kengasong and heads of state. I mean, they all came together, the African Union, to be able to set up Africa CDC. So it's nice to see that happened. Yeah. You are connecting the dots from a hike in Rwanda back here. So I'm very happy about that. And also connecting the dots for other episodes that have come before you. You know, when you talked about Ayurvedic medicine, you reminded me of the former Her Excellency Amina Garib Fakim, who was the very first person we hosted on the podcast. And actually, it was on Women's Month.
Yes.
So it's like we've done a full circle.
It's a full yes, yeah. Exactly.
So very exciting. Taking a step back and look at the world. What are the things that scare you? And what are the things that fascinate you?
Wow.
I don't know which one you want to start with first.
Scares me. Existential crisis. No. That, yes.
Yeah, I know.
What fascinates me actually is how we live with that existential crisis in the back of our minds. And we keep like adapting and pushing.
We're still going. It's not all falling apart. But I don't even know how we're doing it. I think we should have all gone mad by now.
Yes, yes, to think about it. But I think that's why we try to, pass our genomes and have kids, to have a legacy, so that we don't feel extremely useless, because in the vast magnitude of things, in the wider picture, we're very small. But what fascinates me, maybe on humanity on a larger scale, but as Africans, that we are pretty resilient. We are more resilient than we think.
Yeah.
We have survived, for example, COVID better than many other countries with advanced healthcare systems.
Right.
We are resilient, we're strong, we're adaptive, we overcome, we support each other. We have this collective consciousness and being, where we are here together and we move together, and you can feel it. And I think we should focus on that, because this is what differentiates us from many others, our sense of collectiveness. And I'm hoping that we would rather encourage that, not kill it. What scares me the most? where the world is heading to. Um, Again, I was defending the private sector, and I'm saying it's amazing for the economy and the development of the countries. It's amazing to drive innovations, but the overcapitalization of the world scares me a bit, because we might lose some ethical values, which again, as Africans, we hold very dearly. Our ethics, our morals that were passed through generations, that guides us, regardless of religion, regardless of systems, regardless of laws. We carry that within us, and I don't want us to lose it, because the world is moving too fast, too rapid, and forcing us to move into a direction that might not be the best fit. I'm hoping that we will find the balance between advancing and keeping the tradition and keeping the ethics and the morals, which I think would support us, our children, and generations to come. So, yeah.
When you're not dealing with healthcare, medicine, private sector, attending major conferences, what do we like to do for fun? I had something about Oriental Egyptian dancing.
I do a couple of things for fun. I started trying to do jujutsu.
Okay.
Martial arts.
Yeah. Wow.
Yes.
Brazilian
Trying,
jiu-jitsu or
yeah.
Wow.
So, but yes, I love dancing in all forms, and I think dancing has been part of our culture and the way we express ourselves. You know, back home in Egypt, people say, like, when you're sad, you dance. When you're happy, you also call your neighbors and your aunties and everyone, and
you
also
dance some more.
Yes. Exactly. I think it's a form of self-expression. I would also support it from a scientific point of view, how it releases endorphins,
Absolutely.
serotonin, makes you happy.
Yeah.
So yeah, for me, it's my favorite sport to dance.
Yeah.
It moves my muscles quite a bit and makes my brain happy with all the happy hormones that gets released. So yeah, this is what I do in my free time.
And just before you dance out of the podcast, just to the camera in 10 seconds, call to action.
Call to action, maybe to all of us. We are all responsible for our future. Let us take it seriously. Nobody else is going to care for us. Nobody else is going to care for our people. All nations are focused on their own well-being, and it's time for Africa and African leaders to also be the nationalists and the leaders that we are expecting them to be, that we have trusted them to be, that we have voted for them to be, or even if we didn't vote, but still. Support us, we will support you. And for all that, because Juliet, what's really beautiful about your podcast, it's a scientific podcast. And so this is a call to action for all the health experts. Please stay on the continent. Give us your brain, give us your skill set, give us your energy. I think we need you more than ever.
Thank you so much, Dr. Mary Moussa from Africa Health Business. It has been a pleasure having you on this podcast. You have shed light on different things that we don't quite understand, whether it's SHA that has moved from NHIF, our own national health insurance from the Kenyan government. You've also shed some light on why it is a good thing that the US government has pulled out from the African continent, even though countries like Mozambique, South Africa, Kenya, Zambia, DRC will suffer, but sometimes it's important to look from within. Mm-hmm. We have the skills, as you've said, we have the knowledge, we have the experts.
Absolutely. Yes.
Nothing stops us from moving further along. It is surprising that when countries around the world are looking more inward, you are advocating that for Africa, we must look across the continent and come together and work together as one. Thank you so much.
Thank you too.
Yeah. Thank you for tuning in to Connecting the Dots podcast created by me, Juliet. This episode was brought to life by Mumbua and Kevin at Silent Global in Nairobi, Kenya. If you enjoyed this episode, don't just keep it to yourself. Share it. Tag us on CTD Pod Africa on all platforms. Keep the conversations going. Let us know what you'd love to hear about and join me on the next episode. This podcast is a product of Silent Global, an African-founded Science Communication Collective.